In this segment, I want to tell you about a very important, it's called the National Alliance for Drug-Endangered Children, DEC for short. And to tell us all about it, delighted as we have a terrific partnership with an organization known as River Valley Behavioral Health. Want to welcome the Director of Regional Prevention, Brooke Arnold. Brooke, always good to be with you. I realize this alliance it's not new, but they have a training session coming up. Tell us about that.
Yes, so the National DEC Alliance provides training at the national, regional, and state level to help areas coordinate efforts to address substance misuse that affect children and families. So we want to try to break generational cycles of substance misuse and reduce the trauma and just promote overall community health and well-being. So we're going to offer a training here in our region in September.
Like any problem with regard to drugs, there's some pretty disturbing statistics. What's a major statistic we should know about?
So across the nation in the U.S., about 1 in 8 children under the age of 17 in the U.S. are living in households with at least one parent that is experiencing substance use disorder. And that doesn't mean that all of these children will experience abuse and neglect by any means, but most of these children are at much higher risk for child maltreatment or child welfare involvement. So we want to make sure that we're doing all we can to address that as early as possible.
And obviously, this training does benefit the community, doesn't it?
Yeah, so I think a lot of times people just make the assumption that it's law enforcement's job or it's child welfare's job to intervene when there might be suspected endangerment. And so oftentimes there's missed opportunities for others to identify those children living in those types of environments. So it's important that all of us in the community, regardless of our jobs or who we associate with, that we understand our role that we can play, so that we can try to reduce any sort of potential harm or trauma that these types of children can experience.
Now, when this training is offered, what's the time frame, Brooke? How long and whom should attend it?
So we're going to offer the training 4 different times over 2 days, and anybody in the community is welcome to attend. It could be law enforcement, it could be fire, EMS, judges, teachers, any kind of first responders, anybody working in the judicial system would be welcome to come. And we'll be offering it on Wednesday, September 7th here in Owensboro. People can attend either the 9 to 11 a.m. session or the 1:30 to 3:30 p.m. session. Thursday, September 8th, we'll be offering it in Webster County, Kentucky from 9 to 11 a.m. And then also on Thursday, September 8th, it'll be offered in Henderson County, Kentucky from 1:30 to 3:30. There's no cost.
Can they register ahead of time or online?
Yeah, so anybody that's interested can email training@rvbh.com and we will send them a link to register for that. And space is limited at each of those sessions, but as of right now, there's still seats available.
Brooke Arnold with, again, the River Valley Behavioral Health. Brooke, thank you very much. We'll talk to your colleague, Dr. Lionel Phillips, right after this. Thanks very much.
Thanks, Mike.
You bet. And we'll be back with the doctor right after this.